Sex Talk with the Siegel Brothers is a weekly program designed to answer all your questions, including the ones you didn't even know you had, and to clarify the endless debates around the wonderful and fascinating world of sexuality. Join us for real talk about sex from two experts in the field. Richard and Larry Siegel have over 50 years of experience as sex therapists, educators, counselors, and researchers. The Siegel Brothers are recognized around the world as trainers of medical and mental health professionals.
Hello and welcome to Sex Talk with the Siegel Brothers. My name is Dr. Richard Siegel. I'm a certified sex therapist.
And I'm Larry Siegel, a clinical sexologist and certified sexuality educator.
We are happy to have you join us. This is our weekly forum for talking about all things sexual.
Mm-hmm.
Of course, we think every day should be Sex Talk Day, but Friday's our day.
Indeed.
So we are on YouTube on Fridays, 7 p.m. on the East Coast.
Mm-hmm. Please subscribe to the channel. Not only join us when we are broadcasting and watch the show, but help us grow. And the more we can get people to subscribe, the more we can get a better URL. So when we send the link out to people, it doesn't look like spam.
Right.
It looks like exactly what we want it to be. And we just appreciate the support that you've given us thus far and want to keep this going. So subscribe to the YouTube, like us on Facebook. We're still there as well.
And please share and let your friends and family know that they too should be having some sex talk.
Indeed. And it's also a good way if you want to submit a question or a comment. We'd be happy to address it. So send them in. Keep us on our toes.
We typically like to start the show with sex in the news.
Indeed.
But this week it seems that sex is the news.
Yeah,
It's
it really is.
just everywhere. We really need to have one of those evenings where we step back, look at the bigger picture, because it's a mess. And really sexual health is just being assaulted and, at every turn.
It really is. And, there's so many other things that are taking people's attention these days. Obviously, with all the COVID stuff that's going on right now, this is certainly the crisis that we are living in. But, we got to understand that this is a pandemic within a pandemic within pandemics. There are a lot of these things. There are many, many pandemic circles of issues that we cannot forget about, that we have to keep front and center. And especially as they relate to sexual health, the more we lose sight of them, the worse they get.
Yeah, I think there will be few better examples of losing sight of public health crises and taking our eye off the problem than our current state of affairs with sexually transmitted infections.
Yeah.
Really with HIV and AIDS as kind of a centerpiece. If, in 100 years from now, when people look back, the 25, 30 years leading up to HIV and the now 30, 35 years since, it's just been unprecedented. We have been worse than high schoolers on spring break. Supposedly sexually healthy adults have been anything but sexually healthy, and infection rates have shown some troubling trends.
Yeah.
It's no offense to any young people who may be in our audience, but it's a sorry state of affairs when adolescents show the healthiest risk behavior, risk mitigation, condom use, contraceptive use, far better than most adults.
Sure, especially now when adolescents represent the lowest rate of sexual activity. So.
Right, that's another weirdness.
Yeah, exactly. But you're absolutely right in terms of, and we talk about how even among adolescents, that behavior is, let's just say, subpar, right? And it makes the perspective even more important to realize that as much as we can criticize adolescent sexual health promotion, negative behavior prevention stuff, as bad as it is, it's better than adults, like you said.
Yeah.
To say
Right.
that 1 in 4 adolescents who wear condoms at the last sexual intercourse, we could look at that and say 1 in 4, come on, that's ridiculous, but that's superior to the average adult age. Right? So, that's, again, there's so many things that are related to corona. First of all, testing for sexually transmitted infections is almost non-existent right now.
Sure, because
Partner
that's
tracing,
not,
partner notification.
non-essential.
Right.
And health departments are
completely
swamped
understaffed.
and dealing with corona.
Right. And the partner tracing that we can't be doing with corona, that we should be doing, we're now not doing
Definitely
with
not
syphilis and other sexually transmitted infections, which we need to be doing, because just related to that fact alone. And really is that lack of the surveillance, the lack of proper testing, but lack of the partner testing is one of the reasons why when we look at sexually transmitted infection rates, the cases of congenital syphilis, of mothers passing it on to their children born with syphilis, a lot of that is because these moms may have gone and gotten tested but never got any follow-through.
Or didn't have access to health care. Or didn't get any prenatal care and ended up going to the emergency room to deliver.
Right.
And that's the first time they found out about mom's or baby's status.
Right. And and that is another important area where the intersection of sexual health and just social and economic inequality just join up right there. You can't afford health care. You're using the hospital as your basically primary physician, primary health care center, and you're not going to find out anything until it's too late.
Right.
They're not going to be caught early. They're not going to have the testing. They're not going to have the kind of treatments and interventions that we want to see early on. So at that point, we're seeing women in end stage or late stage infections. We're seeing more and more babies. 2018 was the last year that we have the data for.
We're going to put a graphic up to give, if anyone's curious what the CDC was doing before the COVID pandemic.
Yes. And 2018 was a year of panic.
Yeah.
Right? Which, we do seem to have an interesting trajectory in how we deal with particularly sexual health issues. But there's a lot of parallels with corona. At first, we seem to deny it. Right? Then we overreact to it. And then we just ignore it.
That sounds exactly like corona.
Yeah, that seems to be our typical progression of how we go through with these things.
Certainly in terms of the administration's response.
Yep. So when we looked at in 2018, there were a little over 1,300 babies born with congenital syphilis. And that represents a 185% increase from the last surveillance report in 2014.
So in a 4-year period, right?
Right.
And notice the big stat there that says STDs surge for the 5th straight year, reaching an all-time high in 2018.
Right.
We have no idea what's going on now.
Now, no, we don't have any idea. And it's going to probably be a long time before we do. But, there's some of these things that I want to temper in how we hear that. Because, again, here's part of the overreaction, I think, sometimes. How a lot of times this has been ignored. Now, the overreaction. Okay, so we have a 71% increase in total cases of syphilis since 2014. Okay, now that sounds really, really scary. Right? When we look at the numbers.
I see where you're going with this.
Okay, when we look at the numbers, and I don't want to trivialize this in any way, but we're looking at that 71% increase represents 115,000 people in the country.
Nationwide.
Out of the number of people we have, over 300 million, 115,000 is way too many, especially considering that we came this close to completely eliminating syphilis a couple of years ago. This close. But we're back up now. It's on the upswing. So 71% increase is one thing, but we have 115,000 cases.
Yeah, and we're almost averaging that many cases per day of COVID.
I think that's an important perspective. Right? That's a really important perspective. When we look at the cases of gonorrhea, right? Again, it's put out there as a 63% increase. which sounds catastrophic.
Well, it is a pretty horrible sign of sexual health.
Well, yes, exactly. That's definitely part of the punchline. But we're looking at a little over 500,000 people with syphilis now. I mean, with gonorrhea, and this is one of those things where I do think we have to have special concern, not fear, not hysteria. Let's not look at the increase. Let's look at the fact that it is still here, getting worse, and who primarily do we see infected with gonorrhea? Adolescents. And particularly adolescent males.
Again.
Right? However, when we look at a lot of these trends, women of color, especially adolescents, are also very much on the rise. Because again, we've got people in marginalized communities, we have people that don't have access to care and testing and all those things that we talked about before, and we're going to be seeing a lot more of a disproportionate impact in these communities of color. One of the consistently bad issues or underlying STIs is coming with chlamydia. Right? We're approaching 2 million. It's only a 20% increase, but that's still the unspoken. That's still the one that people aren't considering and talking about enough, protecting themselves from. And we're still talking about one of the leading causes of infant blindness. We're still talking about one of the leading causes of infertility in both men and women. Right? So we've got to do a better job.
And this is a bizarre thing too. Even again, we're always talking about just in the course of the 3 decades that we've been in this fight. Chlamydia, just in that time period, has gone from showing up like gonorrhea to now today more likely having no signs or symptoms at all.
Right.
So people who have it don't know they have it,
right,
unless they're getting regular checkups.
Exactly.
I'm Rachel Needle, co-director of Modern Sex Therapy Institutes. And Modern Sex Therapy Institutes is a continuing education provider. We provide continuing education for medical and mental health professionals around the world. And we have over 140 archived workshops on our website, so please check them out at www.modernsextherapyinstitutes.com. Also, we have a number of certification programs, including sex therapy, couples in sex therapy, LGBTQIA affirmative therapy, alternative relationships, transgender mental health care, medical sexology, sex education, and sex counselor certifications. In addition, we offer a PhD in clinical sexology. So please, again, go to our website, check out everything that we have to offer. A lot of our stuff is available solely online from the convenience of your own home or office. We do things live in 8 states and live via webinar as well.
Well, a toast to you, my brother.
Yes,
and
to you as
say
well.
good evening proper.
Yes.
And our customary sake toast. And thank you again for joining us.
Thank you. This, by the way, is a Masuki sake, and it is also referred to, this particular sake, as the mirror of the soul.
Oh. Okay. I thought you were getting a little uncomfortably personal with the cat there earlier.
Well.
So let's put that away.
Yes, indeed.
So, yeah, talking about this pandemic within a pandemic, as you said, and really it's an opportunity to call attention to, as you always like to say, what's going on behind the distraction, right? Behind the clown car. And that is still this systematic war on sex.
Yeah.
Right? It's almost 15 years ago when Marty Klein wrote his profoundly important book called America's War on Sex.
Yes, go out and get it. It's worth the read.
Even, some parts of it might feel dated, but it's still so on time. It was during the George W. Bush administration where he pointed out all of these different battlegrounds in the war on sex, from the beginnings of the war on porn, which we know is still raging, to the ongoing tearing down of the separations between church and state, so that kids are getting basically religious messages in school that God disapproves of premarital sex.
Right, not to mention laws that actually protect that kind of religious bigotry and intolerance.
Right, just all of the hysteria and what Marty called the sexual hysteria industry. Right, it's effective and it's still going on.
It works. That's the problem. Yeah.
This week's issue of Time magazine had a really eye-opening article called 12 Ways Trump Has Deepened Inequality. And of course, with our obvious bias, we tend to see everything through a filter. And as I was reading through these 12 very frightening ways that the Trump administration is stomping on civil rights and equality in this country, I noticed how many of them directly involve sexuality.
Absolutely.
And sexual health,
Right.
and even some of them indirectly.
Well, that's the thing too. Then the ones that jumped out, they directly involve, but how many of them in other ways connect?
5 of the 12 ways
Directly
Trump is
involve
attacking inequality
sex and sexuality.
have to do with shutting transgender people out of housing opportunities, as well as his ongoing war against transgender troops in the military.
Well, I mean, transgender
Regardless
people
of
in
what
general.
the Pentagon says, people who are willing to die for our country and serve,
Right.
Trump still trumpets this nonsense that it's the same kind of crazy thinking as the bathroom bills,
Yeah.
right? The genital inspectors outside of public bathrooms in one of the Carolinas, because of this fear, what do you call it, the Mike Huckabee fear, that guys, child
about
molesters and especially molesters of little girls are just going to take advantage of the law and
That's right.
slap on a dress and say, I'm trans, you can't mess with me, so they can have access to little girls in the women's room.
Yeah. I mean, again,
That's-
I have to call this out. Mike Huckabee, you are a stupid man. You truly are.
Is he even still around, or is he just
No, he's still around.
into
He's
the
definitely still around. I
swamp?
mean, but again, made
Right.
that comment also about using
Oh,
the
yeah.
women's shower.
Oh,
in
if
the
I'd have known
bathrooms.
that in high school, I would have.
Yeah, of course. I
I'm
wanted
sure.
to be in the women's shower too.
Right.
Mike Huckabee, you're a stupid man. Right? In case I didn't say it clearly enough before. Right?
But
So-
this is the same kind of vitriolic hatred that's couched in some nonsense legal reason that people are only going to join trans folks are only going to join the military so that they can get the army to pay for their surgery. Like
Right.
going
Well, that and the flash uniforms.
going to Afghanistan and Syria and Iraq and the most dangerous places in the world and putting your life, you're going to find us out there.
I don't want reassignment or confirmation surgery.
Really? Are people going through? Yeah. Just
I mean,
just
again,
to get
it
a
is-
break on the.
I really do get tired of using the word stupidity. But
Yeah.
it seems to be everywhere.
But is it the stupidity of coming up with these lame excuses, or the stupidity of the people who believe them and say, "Yeah, that makes sense.
Yes.
Sure, we need to put a stop."
All of the above.
Right. One of these battlegrounds is shifting an additional burden onto rape survivors.
That whole change in the Title IX.
Oh my God!
Right?
I
And
mean,
that Title IX
who is
legislation.
evil enough to stand up and say, "Screw rape survivors. We need to protect the universities from liability."
Ooh, I know
Right?
who.
Oh, I think I know. Yes. Our old friend Betsy DeVos.
Mm-hmm.
What is she? The Minister of Education, or what do you call it nowadays? Supposed to be a secretary, but what do they call it in the Politburo?
Yeah.
High Command Minister? I don't
Yeah.
know.
I think evil
But-
covers it.
Why is she getting involved in Title X and
Because
changing
it's
policy?
university, it's education.
Yeah, it's so that rich universities can pay her money to not have to pay out
Well, I mean,
lawsuits.
that's her mindset. I mean, what does she know about education?
Yeah. What does she know about protecting people from being raped?
What does she know about anything? Really? Right?
Well,
So,
yeah.
but this is
Remember,
just
she said that
nonsense.
there needs to be guns in schools in case there are moose
That's right.
running about. Because
That's right.
where she comes from,
That's right.
schools
In
have
case
to
there's
be
a moose
at
running
the
in school,
ready to
kids should
defend
have guns and
themselves
teachers should have guns.
from mooses.
Right? We've got
right?
such a smart administration.
Of course, the ongoing efforts to obstruct access to abortion and to block access to birth control. And of all the aggravating and frustrating things, what should, as it's been said 1,000 times, what should be the tide that raises all the boats? The one thing that everybody on both sides of the ongoing debates over abortion should be behind? What is the thing that single-handedly prevents more abortions than anything else? Birth control.
Birth control.
Oh, but they're against that
Contraception.
too.
Right.
Oh, great. Okay. So they're
That's right.
against teaching people how not to get pregnant.
Right. They're against sexuality
birth
education.
control.
Right.
They're against any discussion of preventing a pregnancy.
Except when, and there was with some of those attempted stipulations, the only time a doctor can talk about contraception or abortion is in the context of it doesn't work.
Right. They're only allowed to
That's
talk
also
about
part of that abstinence only
rates,
requirements.
right? Yeah.
Yes.
Yeah.
Yes.
But the Vatican put nuns on contraceptives in San Salvador so they wouldn't be impregnated when they were raped.
Right.
Yeah,
But let's also
not be
be
random
very
or
clear and
anything
honest
like
about this issue as well. That it is not just about birth control. This is necessary medicine for a number of women's health issues.
Yeah.
Right? And again, that's not what we're talking about. Medicine. Right?
And, oh my God, and any attempt at interfering in the process of a physician prescribing a medication to a patient is akin to practicing medicine
Right.
without a license.
Right.
So all of these high and mighty religious pharmacists who feel entitled to tear up a woman's script for birth control because they don't believe in it need to get the hell out of pharmacy.
Well, those people should be arrested.
That's right. They should be arrested.
Those people should be
and lose
arrested
their
because
licenses.
that's different. And pharmacists really have been doing that.
Yeah.
But there have been those that, because of their own personal principles, have said, I cannot fill this prescription. And if there's somebody else on hand that can fill that prescription, you know what? I can give that a pass. But
That's
the ones
what
that
a conscience clause is supposed to be about.
right. But when you put the
But-
patient at risk and you countermand a medical order, which is what, first of all, tearing up
You're
a prescription,
breaking the
they
law.
have no right to do that.
Right.
That should be lose your license, and that should be a criminal offense.
But, we talked about this a couple of weeks ago.
or at least a civil
Catholic
offense.
churches should not have the right to just flagrantly disobey the law.
That's
and
right.
They do it every day.
That's right.
Right? They should not have the right to refuse to give rape victims information about preventing pregnancy behind that rape.
Right.
But they do. So go figure.
Yeah.
Right. And as we said earlier, even something like limiting access to food stamps, aside from the fact that you have to be an evil prick to kick people off of food stamps,
Right.
that is also an impediment to sexual health.
Absolutely.
If people can't eat, they can't get food to raise healthy kids.
That's right.
That's
That's
these
right.
are ongoing.
And again, you can't eat, then healthcare is definitely not high on your list.
yeah, these are
Prevention
the slow motion
is not high on your
pandemics
list.
that follow.
Right.
Right.
Right. And these are just some of the other sort of those pandemic circles that we have been floating around in for a long time before Corona came along. So, Corona, as much as it brings its own issues and as much as it is a crisis in and of itself, it's just adding another ripple to these already turbulent and muddy waters. So, we can't help but notice that there's so many parallels between what we're dealing with and how we're trying to get people to do what they're supposed to do when it comes to preventing against COVID, and what we have for our entire careers been dealing with and struggling with when it comes to STI prevention.
Trying to get people to do the right thing, to think of someone other than themselves.
And we've talked about this before on the show as well, that, for those of you Americans who believe that personal freedom is very important, please understand, please think about the fact that personal freedom does not mean putting other people at risk. Personal freedom does not mean you have the right to endanger anybody else. And there's nothing, that's not what the American spirit is. That's not what the American value is. Like it or not, that American value has always really been based on personal responsibility and doing what we've needed to do,
We've always-
rising to the occasion.
Always had problems with that. We want the freedom without the responsibility that comes with it.
That's right.
And that's just a free-for-all.
Exactly. And that's not what this country is about. That is not what the Constitution says. Nothing in there says that. Just like we've talked before about the First Amendment does not say you can say whatever you want, whenever you want, to whomever you want, without any consequences.
And the Second Amendment doesn't mean you can be armed to the teeth
That's right.
on some lunatic fantasy that the government's going to come. We'll save that for
Exactly.
another night.
Yeah, but these are important points because it really comes
People
down
need to be informed.
being an American means you do consider your neighbor. It means
You
you
know
do think
your
about
rights.
other people. You know your rights. You know other people's rights.
Mm-hmm.
Right? It means you understand. And I love that. What's his name? The Rolling Stone writer, kind of conservative.
Of course. I know who you mean.
I can't believe I'm blanking on his name.
Oh.
Jay. We'll cut this out. But the fact that your right to swing your arm in any direction you want ends at the tip of my nose. Right? And when we talk about corona, when we talk about STI prevention, it's not just about you. Right? These people that are saying it's my right to be out here if I want to be exposed. No, it really isn't, because you're putting other people at risk. And the parallels, it's not even a parallel. It is an intersection. That it comes down to personal responsibility. We each have our own personal responsibility to make sure we don't get or give either corona or a sexually transmitted infection. And it really is no more simple or complicated than that. Right?
And neither requires the huge sacrifice that people are carrying on.
It really isn't.
Acting like, they're being asked to send their children off to war.
It's
or
mind-boggling.
Escaping for their lives.
It's mind-boggling.
Wear a mask, wear a condom.
Right.
Really? Is it that complicated?
Exactly. And are we that far off from people, these armed insurgents, coming out in public to just kind of protest having to wear condoms? Right? Again, a mask is not any different. It is a prophylactic. That's all it is. And it's about other people, not just yourself. I love the words. He's still one of my heroes. Perhaps the greatest disappointment to the Reagan administration at a time where we did see this coup d'etat in this country. It was a bloodless coup, but it was a coup nonetheless of what called themselves the moral majority, that is now the conservative right. But C. Everett Koop, who was a man of deep faith, he was very strong Catholic, he was very upfront about that, and it was kind of like the Mikey Life cereal kind of commercial,
the
wasn't
Attorney
it?
General.
The Surgeon
General.
Right. Who, his words then they were so important, but they're just as important now. Right? And you remember what he said?
I do.
Right? We can stop the spread of all sexually transmitted infections tomorrow. Mm-hmm. And all we have to do.
All it takes.
It's really this simple.
Is everyone at the same time deciding, I will not give or get an infection at this point forward.
That's right. And as he said, if we stop worrying about who's out there with what, stop trying to figure out how to hedge our bets and just focus on what do we need to do to protect ourselves. If everybody did that, each time we would not give anything, we would not get anything, we would stop these sexually transmitted infections in their tracks. Mm-hmm. It is that simple. And I would say it's also almost that simple. We don't know a lot about corona yet, but we do know how important masks are. We do know how important social distancing is. And if everybody just did that, when you go out in public, wear a mask, stay apart from other people. take it seriously, we would probably have similar success. Potentially. We haven't been doing it with sexually transmitted
instead of being the
infections.
laughing stock of the entire planet, right?
Yeah.
With infection rates shooting upward while everyone else has flattened the curve.
Right.
Everyone else in
That's
the
right.
world.
Now-
and we're not embarrassed about that.
Right, and you're talking about corona, but that
And
same thing can be
dying.
said for sexually transmitted infections.
Yeah.
You know, when we look at the birth rate, the unintended birth rate, we are by far ahead of everybody else in the world.
Yeah.
Our STI rate is by far ahead of everybody in the world.
Abortion rate, the only country that comes close to ours is a distant second, and that's Brazil, which is still a largely Catholic country where abortion is kind of birth control because they're not allowed to use birth control.
Exactly.
Go figure.
Exactly. So, you know, if you are especially an anti-choice, anti-abortion person, we should be on the same side on this. We should be able to work together. Right? We have to know logically and rationally abortion made illegal will not stop it. It'll just make it way more dangerous for women like it used to be. So let's work together and make abortion unnecessary. If we can improve access and availability to contraception, if we can improve sexuality education, right, we'll make it less necessary. It doesn't have to be an issue.
It can
and guess
go
what?
away on its own.
Exactly. And but the beauty of that is that this is truly a one-size-fits-all.
Right?
Because
It's called
if we
sexual
can
health.
do that, that's right. If we can do that, guess what? We're also going to get rid of other sexually transmitted infections. We're going to get rid of HIV.
Now you're talking fantasy.
Right.
You're asking Americans
I know
to
it's
be
a fantasy.
sexually healthy.
Well, I'm asking Americans to be smart. Right? And that really shouldn't be such a reach. Right? So be sexually smart, we will be sexually healthy.
That's the deal.
All right. And
So?
on that note, thank you all. I appreciate you joining us and watching us again. Another edition of Sex Talk with the Siegel Brothers. We raise our glass to you, my brother.
Next Friday and every Friday at 7
to you out
p.m.
there.
Eastern for Sex Talk with the Siegel Brothers. Good night.
Yes. Stay safe.
Thanks for watching Sex Talk with the Siegel Brothers. Join us each week on Friday at 7 p.m. Eastern. You can also follow us on Facebook and subscribe to our YouTube channel to stay on top of the latest developments in the ever-changing world of sex and sexuality.